Shoulder pain, one of those things that can really be a nagging long-term problem. I had a patient recently that had a problem with his shoulder aching for over a year, causing notable pain, particularly interrupting his sleep at night. He's been going to his regular chiropractor where he normally gets good success. No success, went to his doctor. And his doctor said, I'm thinking maybe PT. He came to me and I said, I agree. I think there's something we can do to help you out and it's not going to be too difficult.
Now, many people are misled that they need to have an MRI done right away to find out what is wrong. And these are very expensive. So it is important to talk to your physician about possibly trying alternative routes first before going into MRI and the surgery route, because that is a much longer recovery, and trying therapy first cannot really harm anything.
That's right. As a matter of fact, he did say to the doctor, I want to get an MRI so that I can have surgery. He was already in that mindset. It needs surgery. It's going on for a year. So anyways, let's find out how we solve the problem.
Bob and Brad, the two most famous physical therapists on the internet.
I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
In our opinion, of course, Mike.
And if you're
Go ahead.
new to our channel, please like and subscribe to this video if you find it helpful.
Yeah, but if they're not new, you can subscribe again. Why not? You know?
Sure.
See what,
I don't know if
for
you
the
could
price of one.
resubscribe, but go ahead.
Anyways, let's get serious here. I want to talk about his name is Vince. Shoulder pain. He's taking ibuprofen 3 times a day.
I think we should mention the age.
Well, 72 years old.
There we go. That's important to keep in mind
right.
here.
But very active 72-year-old. His goal was to actually sleep all night long without being awakened by his shoulder and get back to the level where he can actually throw a baseball to play catch with his grandkids. So anyways, we discussed it and I did a complete evaluation, and I knew Vince was the type of person who liked to go to chiropractors, get results, and get things going. Exercising a complete program, probably not going to work so well in his situation. So I looked at him. I said, Vince, you've got scar tissue in your shoulder's tight. Range of motion is limited. It's been a year long. We need to break the scar tissue up. I think you are a good candidate for brachiating, or in other words, hanging. Mike, do you want to discuss that or show them what that is?
So this is a book from Dr. Kirsch, who was an orthopedic surgeon, now retired. It is called The Solution and Prevention Shoulder Pain. In this book, he gives much more in depth of the benefits of hanging and how it can help with your shoulder pain issues you are having.
Right. So I said, Vince, do this. I'll show you how to do it in detail. He said, yes, I want to read the book. So he did actually order the book. It's relatively cheap, $10, $15. So he got more details on it. And here is a simple exercise in 1 week, making significant progress. So let's go over to the wall. All you need is a pull-up bar. You can use, we have hanging handles, so they do work a little bit better than a pull-up bar, and I'll show you why. Mike, you want to pretend you're Vince. He's got more hair than you. But
I'm
great.
72 years old.
Yeah.
Just imagine that.
So this is just a demonstration on how to brachiate or hang in benefit of your shoulders. So his one shoulder was a little tight, so he had a little bit of a harder time to get that one up there. But you grab it back to the wall. If you're using hanging handles, this is why it helps. There should be no weight through your shoulders at this point. He's standing. Now, in order to put weight on in a gradual, progressive manner, Mike is going to bend his knees and allow the weight to go on gradually. Now, if it starts to get any sharp pain, I want you to stop, and you're going to hold it there, okay? Now, you're going to hold it there 15 to 30 seconds and stand up and give that shoulder a break. You know, we don't want to irritate it or tear that scar tissue. We want to stretch it gently over a period of time. It may take a week or up to 2 weeks, depending on how severe the scar tissue is bound up. And you'll do that 2 to 3 times the first day. Now, after you do this the first day, it should be maybe a little sore after you're done, but by the next day, it should feel okay. If it's still sore, take a break and go the day after. Now, after you do this a few days, it'll start to break that scar tissue up. You can come back up, Mike. Now you can get more aggressive. Go ahead. let's say we're on day 4. Things are feeling good every day. There's no extreme soreness. Now Mike is putting more weight, and he's going to time it or go at a normal, whatever feels good. When I hang, I just do it for maintenance. I usually hang 15 to 20 seconds, maybe more. Mike actually has some weight going through his feet, which is just fine. Don't go too much too soon. And how you doing, Mike?
I'm doing good. I would mention messing with your grip is going to determine a lot of this. So my hands are facing forward. This is typically how we do it. If you go this way, you're going to feel a slightly different stretch. But most of the time, we recommend just going with the outward grip like this and dropping down. The next progression would be, if you could tolerate it and you have the upper body strength, is actually hold yourself up with no weight. That would be even more shoulder stretching. Obviously, if that's too painful or you don't have that motion, you don't have to progress to that. And some people even, I've worked with individuals that can't really get up this high yet. So what some of them may do is actually go to a pull-down machine. So if you happen to have access to a gym, the lat pull downs, a lot of people go a very light weight and they just go up as high as they comfortably can and just let it hang there. They don't actually do the pull down exercise, but they'll kind of hang that way.
Sure. The other thing too is you could just start with one hand. You know, if you cannot get up with both hands, you can get up with one. And this would be for a real tight shoulder and gently work. And that's why you need to have these low. If you have to jump up to a pull-up bar, you'd have to have a stool, something you could control your stretch and weight bearing. So again, the book is an excellent resource. Now, here's what happened. Vince did this. He called me up a week later and he said, Brad, and I'm thinking, I hope he's okay. He said, Brad, my shoulder feels much better. 80% better. He's now able to sleep throughout the night with no ibuprofen. Everything is going much better. He said, what do I do next? So I met with him again. We went through some more stretching. He's going to continue to hang. And then for his goal of actually throwing a ball with his grandkids, he's not going to be throwing 100-mile-an-hour pitches. So what we're going to do is, I said, get a band like this, stretch band with a handle on it. I'm going to put it on the wall anchor here. You can wrap it around a solid post like for the stairwell, the handrail, whatever you have that will be solid. And this is one of the key exercises. It's a rotator cuff exercise. Elbow stays. You wanted to get that towel over
Elbow
there?
stays in, but if you're a cheater like many people, just put a towel under there. The towel falls out, you're cheating.
There you go. So Mike's going to help me out. There we go. Now,
Also collects any pit sweat.
there you go. So this is proper. We're going to do 10 to 15 of these, 3 sets of them. Do that daily. Now, this is what happens if your elbow comes out too far. That's not going to work the right muscle. Keep the towel roll in there. Okay, the next one is when it's getting better and it starts to feel like maybe you can throw a little bit without a ball. Then you take this and go like this. And this is the same motion. I'm going to come back, little resistance to start with. And then as you get stronger, you can do this, kind of that same motion as when you're throwing the ball. Try and keep the elbow still so we're not doing a real throw, but working this, work the rotator cuff muscles. 10 of those, 2 to 3 sets, and do that daily. So there, and that's where he's at right now. So things are going very well. If you have any question about these hanging handles, if you want to get these, actually, Bob and I came up with this idea with Dr. Kirsch after reading his book. But this, if you want these, you can order these. Where do we get them?
You can get them at bobandbrad.com.
There you go. And as well as you can, when you order them, you actually get 4 of them at bobandbrad.com. This is a commercial, but it's the best place to get them, and they work very well. We've sold thousands and thousands of them. Here's how they work. You must have a wooden stud in your house. Otherwise, you cannot use them. This would represent the drywall or the wall. The screw goes in to the wooden stud. Steel studs do not work. Some houses have those, and this is how they look, and you'll get 4 of them if you order them from Bob and Brad. If Amazon, I think you'll get 3. You can put one up high, one here, and one down low for a whole variety of other exercises, from legs to shoulders to back to core. They're amazing. We have videos on those as well. If you're buying them just for this exercise, you could, but remember, they're useful for a lot of different exercises. Anyways, so there you go. A 72-year-old sore shoulder, 1 year, problems, pain, no sleep, fixed because of Dr. Kirsch's. By the way, Dr. Kirsch said his shoulder surgeries had gone down, I believe, more than 50% after the people start using the hanging problem, typically with shoulder impingement, which is a very common shoulder issue. Wow. Mike?
You like talking a lot.
Yeah, I talked a lot. I'm done, but
That's okay.
Yeah, what do you got to say?
What do I have to say? If you want to check out more videos on shoulder strengthening, you can click the video link on the screen. 7 rotator cuff exercises for pain relief, non-surgery rehab.
There you go. And also, now that we're exhausted, or I am, we can fix just about anything except for
a broken heart. But maybe Dr. Kirsch should get into
Yeah, he could write a nice little book on that as well. We'll ask him. Anyways, take care, have a good day, and keep your shoulders healthy.
Bob and Brad, the 2 most famous physical therapists on the internet.